My name is Bezankeng and I'm here to do my head-to-toe assessment. Here are my equipment and my surroundings. Hi, Mr. JK, how are you?
I'm fine. How about you?
I'm good. I'm your student nurse practitioner. I'm here to do some head-to-toe assessment on you.
Okay.
How are you feeling today?
Yeah, I'm kind of I have some kind of high blood pressure and some kind of lower abdominal pain.
Okay. Since when did that start? Like 3
think,
days ago?
Almost 3 days ago. Yes.
Okay. Alright, so I'm going to ask you some few questions and I'm going to have you repeat some stuff after me, okay?
Okay.
Will you give me the permission to go ahead with this?
Yes, please.
Can you tell me your date of birth?
July 11, 1984.
Can you tell me the president of the US?
Joe Biden.
Can you count from 99 to 92?
99, 98, 97, 96, 95, 94, 93, 92.
Can you tell me the date of today?
August 6th.
Okay, I'm going to tell you these 3 words and I'm going to ask you to repeat them after me, okay?
Okay.
Good, better, best, okay?
Okay.
Alright. Moving forward, I'm going to have to wash my hands. I'm going to use the hands, I'm going to sanitize it. And I'm going to start by taking your vital signs, okay?
Okay.
So you said your abdominal pain started 3 days ago, so how does it make you feel?
Yeah.
Like some pooping issues, a problem going to the bathroom, kind of stuff?
Not pooping issue, but just the pain. I feel the pain.
Okay, alrighty. So, your pain is a fit vital sign, okay? So, that being said, I'm going to go ahead to check everything. And my temperature thing there. Okay. Okay. Alrighty. Temperature 97.8. Okay.
Okay.
So while I'm taking your oxygen is 98. Okay. Blood pressure is a little bit elevated.
Okay.
147/98. Okay. Your pulse is 88 too. So with that being done, I'm going to move forward by you're going to tell me the sensations you feel, okay? If it's a sharp or a dull sensation. Can you close your eyes for me?
Okay.
What do you feel?
Sharp, dull, sharp, sharp, dull, sharp, sharp, dull, sharp, sharp, dull, sharp, dull.
Okay, the senses are okay. From there on, I'm going to move forward with the head-to-toe, with your head-to-toe assessment. I'm going to start by palpating and inspecting your hair for any masses, lumps, okay? I see you're well nourished, okay? Skin color is equal to ethnicity, okay? Can you stand up for me? Can you walk? Okay. Your gait is normal, okay? Have a seat right there. Normal gait, posture is okay, well nourished, and skin is equal to ethnicity. Now I'm going to start by inspecting and palpating the head. I'm checking for any lumps, masses, cuts, infestation, hair loss, alopecia, which I see none. Okay. As I'm doing this, do you feel any pain on the upper side? The pain is just on your stomach?
Yeah, only on the stomach.
Next, I'm going to move down. Nothing noted on the head. I'm going to move next to inspecting the ears. Okay. With your ears, I'm going to look through your ears. Okay.
Yeah.
Do you feel any pain as a kind of palpate your ears?
No, please.
Palpating your ears, no pain?
No.
Okay. I'm going to look through, inspect your tympanic membrane. Okay.
Okay.
So, looking through, I'll see no swelling or redness. The tympanic membrane is is nice gray and pale. I pull up and back again. I look through this side. Okay, tympanic membranes are good, no drainage. It is gray, nice and pale. So I'm gonna do you some check some hearing tests. Okay, this is like cranial nerve number 8, which is vestibular cochlea. So I'm going to use a turning fork. I'll hit the turning fork and you're going to tell me where you feel the vibration. If it's on both sides of your ears or on one side, okay?
Okay. Both sides.
Okay.
It's vibration. I hear vibration. Yes, I hear vibration. It's a vibration. It's a vibration.
With that, the cranial nerve number 8, vestibular cochlea, is okay. Coming down facially, okay, I can see here, cranial nerve number 7 is the facial nerve. Can you smile for me? Frown, puff your cheek. That nerve is okay. I don't see no facial drooping. Like patients with strokes have some facial drooping. I don't see none of that. I'm going to move next to the eyes, okay? With your eyes, I'm going to have you look at me this way. So I'll have you close one of your eyes, the right side. Close the same, okay. Do you see any number right here?
Yes.
Which
2.
number? 2. This side 2?
2.
Okay, that is cranial nerve number 2, which is the optic nerves, which is okay. I'm going to move on to check your cranial nerve number 3, number 4, and number 6. That is your oculomotor trochanter and adductor, okay?
Okay.
So, with that being said, first of all, I'll have you occlude one of your eyes and read from my Snelling chart which number you can
F, P, H.
The next side, you close the next side.
F, P, H.
Okay. I'm going to do the 6 cardinal point of gaze. I'm going to bring this pen closer to your, put this pen, and I'll have you look at the movement of the pen with your eyes, not with your head. Let your head, since being stable, you just follow with your eyes. Okay. Looking at the pen, I'm going to bring it closer to your eyes. Okay.
Okay.
That's for accommodation. See the eyes crossing. Now I'm going to inspect your conjunctiva and your your sclera. Okay. Okay. It's white. Okay. Okay. Now I'm going to check through the vision. You look through your eyes. Okay. Okay. My patient's visions are okay. Cranial nerve number 3, 4, and 6 are okay. Next, I'll move down to the nose. I'm going to inspect the nose. Nose is symmetry. I see no drifting. So, do you have any pain as I palpate your nose?
No, please.
Okay, I see no drainage. I'm going to check the nose for any polyps. Okay. Okay. Can you occlude your one side of your nostrils and breathe? Okay. No labor breathing. The other one. No labor breathing. Then I'm going to do your smelling. Can you close your eyes for me? Can you tell me what you smell?
I smell tea.
Okay, tea. Nextly, I'm going to go back to your vision. I'm going to check for your pupils reaction, okay? To light and accommodation. So have you stare right there at that light where I use my pen light to check your pupils reaction, all right?
Okay.
Normal people is between 3 to 5 centimeters. So, okay, constriction, dilation again. Okay, constrict. The eyes constricting well. So, cranial nerve number 1 is olfactory is okay too. Now I'm going to check for mastication. That's cranial nerve number 5, which is trigeminal. Also, have you open your mouth while I feel your temporal mandibular joints, okay? Can you open your mouth for me? Can you open your mouth? Okay. Can you try to move to chew? Okay, alright. And I'll have you open your mouth against resistance. Okay, alright. The trigeminal nerves is okay. Next, I'll move down to the mouth, okay? Using my pen light and my tongue blade, I'm going to inspect the buccal cavity, the mucosal membrane. Can you open your mouth for me, please? Okay. Alrighty. I see no loss of tooth. No loss of tooth, okay. Underneath the tongue, no lesions. Checking your tonsils, okay. Mucous membrane is moist and pink. And right here, I'm going to also go ahead and check for some gag reflex, okay, which I feel like. Can you stick your tongue out for me? Take it side to side. Okay, open your tongue, open your mouth. Can you say ah? The uvula is nice, midpoint and vibrating. Can you also cough for me? Okay. All right. The mouth is okay. So hypoglossal and the glossopharyngeal nerves are okay. Just talking to my patient, I know the vagus nerve too is okay. So I'll move next to the neck. Can you take your shirt a little bit off for me? With the neck, I'm going to inspect the neck for any skin breakdown. Okay, I don't see no skin breakdown. Okay, neck is okay. So can you move your neck up and down for me, side to side? Okay, can you move your shoulder against resistance? Okay, cranial nerve accessory is okay too. Now, with the neck being, with the head being 45-degree angle, I'm going to inspect the carotid pulse too, and I'll listen to the carotid pulse for any breath. This is the only pulse you don't inspect on both sides. So you inspect the carotid pulse, nice and bounding 2+. On the side, nice and bounding 2+. Okay. I'm also going to listen for some breath. Okay, which I get known. Now I'm going to move further by inspecting the lymph nodes. I'll have my patient drink some water while I inspect the thyroid gland. Sorry. So can you drink some water for me? Okay. Do you feel any pain?
No, please.
Okay. Alrighty. The thyroid glands are okay. From there, I'll move now to inspecting the lymph nodes. The lymph nodes, I'm going to start right here with the pre-auricular. You feel any pain while doing this?
No.
The post-auricular?
No.
Occipital?
No, please.
Feel any pain?
No.
The parotid?
No.
The tonsillar?
No.
Feel any pain?
No.
Okay. Submental? Submandibular? So now I'm going to go through the superior clavicle.
No
Feel
pain.
any pain?
No pain.
And while I go through the clavicular chain, feeling for the deep clavicular.
No pain.
Okay. The deep clavicle.
No pain.
No pain. And then the post
No pain.
clavicle. Okay. No jugular vein distension noted. Okay. And then I'm gonna feel for the supraclavicular. You feel any pain?
No.
Okay. All right. With that, we're done with the head. Moving down to the chest and the upper extremities. Can you take off your chest for your shirt for me? I can see no I can see no labor breathing, no use of accessory muscles. Okay. With this one, I'm going to now inspect the chest. I feel the skin, no sweating. Okay, skin is dry. Okay, I'm going to listen to some heart sounds, starting from the sternum notch right here down to the angle of Louis. Okay, feel for palpate for any hives, leaves, and thread which I see none. Okay, moving from the angle of Louis to second intercostal space, I'm going to feel for the aortic pulse. Okay, move across right there. Pulmonary, here, S2 is louder. I'll move down. Erb's point. Okay. Tricuspid. Here the S1 is louder, and I'll move to the mitral. The mitral is the point of maximum impulse. You listen here for full 1 minute. The normal beat should be between 60 to 100. Okay. I also use the bell. After using the bell, also use the diaphragm too. And then, okay. Okay. No abnormal heart sound. So I'm also going to listen to your lungs. Okay, you have the upper lungs area, the mid lungs, and the lower lungs area. Okay, yeah, I'm listening for any kind of crackles, wheezes, stridors, anything I can listen as abnormal. Okay, from here I'm going to start listening right up here from the apex. When I'm listening to that, I'll have you take deep breath in and out so I can listen to your lung sound. Okay.
Okay.
All right. Okay.
Okay.
Starting from the apex, you breathe in. Breathe in. Okay. Breathe in. In. Okay. Breathe in. Breathe in. Okay. Breathe in. Breathe in. Okay. Come to the back. Breathe in. Dip. Breathe out. In. Okay. In. Breathe in. Breathe in. Okay. Okay. I hear no abnormal lung sound in there. Right here, I'm going to also have you say E while I listen to you for egophony, okay?
Okay.
So E, 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 E. Well, I'm listening for some resonance. This is egophony I'm doing. E. Okay. E. Yeah, you hear the vibration in there. So I'm also going to listen to that behind you. E. Okay. E. Alright, so nextly, I'm going to have you say 99, okay?
Okay. 99.
Okay.
99.
I'm using diaphragmatis.
99.
Okay.
99.
Alright, we shall feel that. Then nextly, I'm going to have some percussion of your chest, okay?
Okay.
I'm going to percuss and listen to some dull sounds, okay?
Okay.
Right here, second intercostal space. Okay. Alrighty. Okay. Okay. around the liver area, it's going to change because it's going to be dull. Okay. To the back. Okay, it's dull. Listen to any air in the lungs. You see, it was really dull. So except around the liver area that you feel the dullness on there. So it's okay right there. So right now, I'm going to move also to inspecting some upper muscle strength. Okay, so I'm going to have your hand right here like this. I'm going to push and you push back. Okay, 5 plus. Okay, I'm going to have to do some flex and extend, some range of motion of the hand. Okay, which I'm going to do on the same side. Range of motion of the hand, flex, extend. Okay, I'm going to also have you do some rotation of your hands. Okay, we shall see no issues. Inspect the fingers for some capillary refill. Okay, less than 2 minutes. Okay, just right there. So that being said, I'm going to also check for some can I have you also have your hands abduct and abduct on both sides, abduct and abduct. Okay, all right. Range of motion of upper extremities are okay. After checking on the temporal and the carotid, I'm also going to check on the brachial, pulse, and the radial. Okay. Nice and bounding. 2 plus. Nice and bounding. 2 plus. I'm also going to check for some reflexes on the upper extremities. Here. And here the biceps. Okay. The tendon reflexes. So I'm going to hit the tendon reflex. I'm going to see some reflex of the hand. Okay. So when I do this is a bicep. Relax your hands. Just relax. Okay. Here. Brachial release. Okay. You see which on the fingers. You see the fingers are gonna cup. Okay. Relax your hand here, the tricep. Okay. We want to see the hand moving inward. Okay. These reflexes are okay. Same to on the other side. Okay. Okay. Alrighty. The upper extremities are okay. So now I'm going to move to the stomach. Okay. All right. With the stomach, I'm going to have you lay on the bed. Have you lay on the bed. Okay. Your stomach, I'm inspecting the stomach. Okay. I don't see no skin breakdown, no opening, no lesions, no spot of like colostomy kind of stuff, nothing. I can see you breathing normally, your stomach. So right here, I'm going to listen to the stomach on the 4 quadrant, starting with the lower quadrant. Right lower, I'm going to listen. Okay, right upper. Listen. Since my patient complain of pain, I'm going to also pay close and do some light palpation to feel the pain on my patient. Right here, I'm also going to check on some pulses. Right here, starting from the xiphoid process. Right there. Okay, I'll listen. The xiphoid process. Hear an abnormal sound too. I'll move down to the renal arteries. renal arteries. And then move down to the iliac arteries too. Okay, still listen with diaphragm on the bell. Okay, here the renal from the xiphoid, the xiphoid position you listen to the aorta, move to the renal, iliac, and here we have the femoral. So now, after listening, I'm going to do some light percussion. You feel anything?
Yes.
Right there, the lower side. Now I'm also going. I'm going to do some light palpation of your stomach. Okay. I know you feel pain. I'm not going to be that deep. Light palpation. Light palpation. Okay. It's a lower abdominal area.
Yes.
Okay. Well, I do palpation now because I don't want to mess. If I could palpate up, I could have messed up like your bowel sounds. So I want to try to listen to them before we do any palpation on top of them. Okay.
Okay.
All right. With that being said, so now can do some little deep palpation. Tell me if the pain is really too much.
That's okay.
Okay. Okay. All right. Okay. All right. Okay. All right. Now I'm going to now inspect on your liver. Okay. Your liver border. So have you breathe in. Breathe in. Out. In. Okay. The response right there. All right. I'm also going to check on your kidney for ballotment. Okay.
Okay.
All right. Breathe in. Out. Okay. All right. On the other side. Ballotment of the kidney. Breathe in. Out. In. Out. Okay. Let me have you sit up. Okay. Sit up. Also check on this. Okay. Your kidney. Okay. Alrighty. That being said and done. Checking on that now. I've already inspected your stomach for you auscultate and listen to it. Hear some bowel sound more in there, and then with the pain on your stomach, we're going to talk about that later on. Okay.
Okay.
So right now I'll be moving down to your lower extremities. Okay.
Okay.
With your lower extremities, I'll have you sit back right here. Okay. Let me see you. First of all, before I do your lower extremities, can you stand up for me? Right there. Stand right here. Okay. Let me see you flex and extend your body back and forth. And have you touch your toes. With this, with what you're doing on your neck, I'm here to check on your alignment of your spine. Okay.
Okay.
All right. This is from your cervical spine. I'm going to check for the C7T1 joint. Okay, this is it right here.
Okay.
7T1 joint. All right. So right here, this are your cervical spinal area.
Okay.
Moving over to your thoracic area.
Okay.
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 To the lumbar. This is your lumbar area. Okay.
Okay.
Your sacral.
Okay.
Sacral area and your coccyx. Do you feel any pain?
No, there's no
monitor
pain.
on this side?
No pain.
Okay. Alright. You can stand up. Alright. Have a seat. That being said too, I'm going to also check for, I've already checked for your senses on your lower extremities too, right? Checking on your lower extremities. I don't see no abnormal swelling, no edema. Okay, no skin breakdown, nothing. I'm going to check for capillary refill now. I've already checked on the upper extremities, on the hands. I'm going to check on the toes too for cap refill. Okay, less than 2. Close, okay. Less than 2. Okay. While sitting right here, I'm going to check for the strength of the lower extremities, okay?
Okay.
Can you push forward? Okay. And pull back. Okay. Can you lift your feet up? Okay. And push it down. Okay. Nice and good strength, 5 plus. Okay. I'll also have you right sitting. I'll have you use your fingers. Touch my finger. This is for accommodation. So touch your finger to your nose. My finger to your nose while close your eyes. Okay. Look at my finger right here, like this.
Okay.
Finger to nose, finger to nose, finger to nose, finger to nose. Okay. Okay. Let me have your shin, your heel to your shin. No, right here. Heel to your shin. Okay. Heel. On both sides. Okay. Okay. Now I'll have you stand up right there. Stand right straight up. Look at me and close your eyes. Hands by your side. Okay. Rumble test. Also with your hands upward. So some pronator drift. Okay. No prenatal drift. So why sitting on the bed? Why sitting on the bed? Okay. I'll have you do. You're gonna let me check for flexion and extension of your knee. I want to see how far your knee can go. Okay.
Okay.
Okay. I have to have you flex and extend your knee. Okay. Let's extend. Next one. Flex. Extend. Okay. I'm going to do some range of motion on your hips. Okay.
Okay.
I'm going to also have your legs go up. No, straighten your legs up. Okay, and down. Flex and extend. Flex and extend. Okay. I'll have you do some adduction and abduction of your knee. Abduction means you're going to open your legs and then you close it back. Okay.
Okay.
Abduction. Abduction. Abduct. Okay. Let's do one at a time. This one. Abduct this one. Abduct. 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 Okay. I'm going to do some flexion of your toes. The plantar flexion. Okay.
Okay.
Dorsiflexion. You go out. Your legs going to open out. Okay. And then the plantar flex is going to go back in. So let me see you dorsiflex your legs. Out. Okay. Plantar flex. In. All right. While still lying right there, I'm going to also check on some reflexes on your lower extremities. Okay. I'm going to check on your Babinski reflex. I'm going to strike like on the opposite 7 underneath your feet. Okay.
Okay.
Okay. See, it's curling. Alrighty. Alright. While sit there, we're done. So you sit up. Yeah, I'm going to check on, you sit right here. I'm going to also check on your reflexes. I'm going to sit right at the back. Right at the back. So I'm going to check on the patellar reflex right here. The achilles right here. So I'm going to knock on your tendon, this tendon, your patellar tendon, and your achilles. I'm going to have you. You're going to see how your legs going to move. Okay. That being said, have you have your feet, relax your feet. Okay. Relax your feet. Okay. Okay. With this one, we want to see the achilles moving up or downwards. Okay. 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 Move to the other side. Relax it. Okay. Okay. To the lower, still on this side, I'm going to move by checking some pulses. We have the popliteal pulse, right? underneath here, I'm gonna have to flex. Someone check teeth, palpable pulse. Okay. To the side. You can feel it, okay? Then the posterior tibial right here. Posterior tibial right here. And the dorsal spade is right here. Okay. Posterior tibia right here. Okay. The solid space right here. Okay. Now you check for your senses right there, which are all good. I check everything looks normal to me. Before we started, can you remember I gave you 3 words? I asked you to tell me. I'm going to ask you to tell me the 3 words at the end of it. Can you remember those 3 words for me?
Yes. Good, better, best.
Okay, my patient's memory is intact. So now I'm going to give you some teachings on our findings. Okay, due to the pain in your lower abdomen, it may be from some appendicitis. We don't know, right? Maybe appendicitis. It may be some kidney issues. You have some issues with your intestine. Okay, so what I'm going to recommend for you, if you feel increase in nausea or vomiting, okay, and increase in the pain, you have to now follow up with specialists. Okay? And for the blood pressure that I see that we took, blood pressure is like the force of blood through your arteries. That means there's a narrowing in your arteries, which can lead to further cardiac or health issues. With that, blood pressure issues are from some issues like sedentary lifestyle, smoking, obesity kind of stuff, more of salty foods, which with that, to counter that, you have to, like, if you're smoking, you have to like cut down on smoking. Sedentary lifestyle, you have to eat more healthier food choices. You have to cut down on your sodium, less drinking, okay? With other, and you have to adhere to your medication regimen, the prescription medication by your doctor. You have to adhere to that. With that being said, do you have any problems? Do you have any issues, like any recommendations or anything you have any doubts on?
No, doctor, apart from this, I'm okay.
Okay, all right. It was nice meeting you.
Nice to meet you.
Alrighty, I'm gonna also go ahead and wash my hands, and we come to the end of our head to toe assessment.